leaks tonight. The average patient at Sutter General overcharged more than 400%. Take a look at the numbers put out by the Union of Healthcare Workers. One tab of amoxicillin, that's a common drug used to treat infections, goes for $17.56. A tablet of Ambien, that's a popular sleep aid, $40. Sincere Tonsil explains the efforts to cut down on the markup.
Clipboards in hand, nurses and techs from Sutter hospitals take steps to revamp the way their employer does business.
We don't have a choice. There are lots of times, especially where I work, when you're in a trauma, you don't have a choice about whether you go for health care or not. And then you're faced with crippling financial burden when you're out, and so that's something that we can change.
See that $44.09 price for lotion on this union sign? That's just one of the numbers these folks are taking issue with.
Sutter, they bring prices up up to 400 or 500%. And so they're going to fight us.
SEIU-UHW members are trying to take the pain out of what they see as extreme price gouging by gathering signatures to get the Fair Healthcare Pricing Act of 2012 on the November ballot.
We've already collected 150,000 signatures in 2 weeks.
Those signatures could let voters choose if hospitals should be prohibited from charging more than 25% above the actual price of providing patient care. The other initiative the group's working on, the Charity Care Act of 2012, which would increase the amount of money available to cover services for those who can't pay. For a campaign rooted in the rhetoric of fairness, the State Hospitals Association says these petitioners aren't being very fair themselves. According to Jan Emerson Shea, quote, they're targeting hospitals where unions want to make inroads, unquote.
It is great to be here with my partner, Senate President Pro Tem Darrell Steinberg, and talk about our joint efforts to preserve in-home supportive services programs which allow for thousands of Californians to maintain their independence and live a life of dignity. We're working with providers, consumers to make changes that will strengthen the program, bring efficiency for taxpayers, and an even greater level of care for our consumers. We'll also be working with providers to make sure that they have access to the training that will ensure that each provider has the tools to provide the enhanced care that our consumers so desperately deserve.
Provider coalition with the consumers, with all the advocacy groups, but with the Speaker of the State Assembly. Our purpose today is to not just have the same old budget discussion about how we prop up the existing system. Let's once and for all have a real discussion and action on how we change and stabilize the system so that in the long run everybody wins.
Today we're here at Kaiser Roseville. We've organized about 6,000 folks, UHW, statewide, and we're here today to kick off national bargaining.
Our bargaining priority is very important because we want to take this opportunity to commit ourselves and commit our employer, Kaiser, to get behind and try to fix that healthcare system that's broken in California.
Today I'm here to walk for a better contract, to get healthier. I think that I'm a part of a great union, SEIU-UHW, that is concerned about health. And so much so that they're launching a Let's Get Healthy California platform, and I'm just excited to be here today and be a part of that.
Well, as a healthcare worker, I feel it's my responsibility to show Kaiser in the community that we're going to walk the walk and we're going to talk the talk.
You know, I want to be a leader and say, you know, we need to change our healthcare. We need a better system. We need California to get healthy. And by doing this walk, we're showing as leaders that we can do it. We can change. We can change the system if we just move forward. Let's get healthy, California!
volunteering for the Chivas Health Fair. We want to bring the health care to the people, let them know that in order to keep healthy, they need to get routine screenings, blood glucose and blood pressure screenings. That way we can get healthy, get everybody a lot healthier, and that's what we want to do. We want to give back to the community.
My name is Martinez. I'm a chef for IB Hospital, and I'm a UHW member. And what I believe is when we work for the kids, for the young people, we work in our future. Chivas USA and UHW, they're getting together to reach the community, to support the community. Work together as a family.
I know, just being an athlete, you know, there's so much placed on a healthy body, a sound mind, sound body, so I think they go kind of hand in hand.
Chivas USA and the SEIU-UHW campaign of Let's Get Healthy California is being brought to you in a way that no one else has ever done, and doing something that no one else has ever done on a very large scale to help people. And this is a great day to get that started.
I didn't realize it was going to be a big turnout to be part of the community, to be part of bringing the awareness of Let's Get Healthy California out there. It was fabulous.
We don't want to be the people that are going to be sitting on the couch complaining about the problem when we can be in the loop fixing it.